Hey everyone, welcome back to our channel. Today, I'm diving into a crucial topic, the differences between borderline personality disorder, often abbreviated as BPD, and bipolar disorder. These two mental health conditions are frequently misunderstood and sometimes even misdiagnosed. While they share some overlapping symptoms, they are fundamentally different in their nature, causes, and treatments. Understanding these differences is key to accurate diagnosis and effective treatment, which can significantly improve the quality of life for those affected. First up, let's talk about mood shifts. Mood swings are a common feature in both BPD and bipolar disorder, but they manifest differently. In BPD, mood shifts are typically intense and short-lived. They're often triggered by interpersonal events like conflicts or perceived abandonment. These emotional reactions can be very rapid, changing within minutes to hours. On the other hand, in bipolar disorder, mood shifts are more prolonged. They occur independently of what's happening around you and can last for days, weeks, or even months. These shifts include periods of mania or hypomania and depression. Now let's get into some defining characteristics of BPD. One major aspect is emotional instability. This includes behaviors like splitting, where someone sees things as all good or all bad, and projection, where they attribute their own unwanted feelings to others. These behaviors can make relationships very tumultuous. These behaviors are particularly outlined by Otto Kernberg, a prominent figure in the study of personality disorders. Another key feature of BPD is hypersensitivity in relationships. This means that symptoms are heavily influenced by close relationships and fears of abandonment. This fear can lead to frantic efforts to avoid real or imagined abandonment, causing significant distress and instability in relationships. Think of it as an abandonment depression, a term used by experts like Gunderson and Lyons-Ruth. This concept helps explain the intense emotional reactions seen in BPD. But what about bipolar disorder? One crucial thing to note is that it often responds well to medication like lithium, which can help stabilize mood swings. Medications such as mood stabilizers and antipsychotics are commonly used to manage the symptoms of bipolar disorder, making it more manageable for many people. That's not the case for BPD, where medication typically doesn't address the core symptoms. Instead, therapy, particularly dialectical behavior therapy, DBT, is considered the most effective treatment. Misdiagnosing BPD as bipolar disorder can lead to ineffective treatments, so getting it right is essential. Accurate diagnosis ensures that individuals receive the appropriate therapy and support. Lastly, let's touch on cyclothymic temperament. This involves chronic, low-grade mood instability without the identity diffusion and interpersonal hypersensitivity of BPD. People with cyclothymic temperament experience mild mood swings but maintain a more stable sense of identity and are less affected by interpersonal dynamics. It's another layer of complexity in understanding mood disorders, highlighting the importance of nuanced diagnosis and treatment. In summary, while both BPD and bipolar disorder involve mood swings, their triggers and treatments are quite different. Recognizing these differences can lead to better outcomes for those affected. Understanding these nuances is vital for anyone navigating these complex conditions, whether personally or professionally. Thanks for tuning in. If you found this video helpful, don't forget to like, share, and subscribe for more insights into mental health. See you next time.